and I'm Janine Bell-Smith. I am John Middleton, the past president of the Optimists Club. We meet every Wednesday here at Pee Wee's Place at 12 noon. That's at 2325 Anderson Road in beautiful downtown Crescent Springs. For our TBNK viewers, today is Wednesday, October 5th, 2022. Our speaker series is taped and rebroadcast on Spectrum Channel 203 in Cincinnati Bell, now known as Ultra Fiber, Channel 815 on Thursdays at 8 p.m. It is also posted on the TBNK On Demand, Roku, and TBNK Facebook, and also our Covington Optimist Club Facebook page. We're pleased to announce our general election speaker series for the Kentucky general election on November 8th, 2022. Our speaker series is aptly named Meet the Kentucky Candidates Vying for Your Vote. The House of Representatives in Kentucky has 100 representatives elected from 100 single districts, and the Senate is composed of 38 senators elected from 38 districts. Every 10 years, districts must be reviewed and redivided, and if necessary, redrawn or redistricted as has occurred recently. The current makeup of the Kentucky General Assembly is 75 Republican members in the House and 25 Democrat members, and in the Senate, 30 Republican senators and 8 Democrat senators. I may say that 30 and 8 is a reverse from the 1970s when it was 8 Republicans and 30 Democrats. So that's how things have changed. We are very pleased today to have our speaker for the 64th District, our current incumbent, Kimberly Poore-Mosier. And I have the distinct pleasure to be able to introduce her, and she's going to tell us a little bit about herself and what she's been up to as a state representative. Please give a warm Optimist welcome to Kim Mosier.
Well, thank you very much for having me. It's great to see all my friends here, and thank you to TBNK for broadcasting this. It's important to get the information out. My good friend Jason. So. It's good to see everyone. I am Kim Mosier, State Representative of the 64th District. And the 64th District is Taylor Mill, Independence, a little bit of Erlanger, a little bit of Edgewood. I have moved after redistricting into Latonia. I have some of Latonia and some of Covington. I have lived in Taylor Mill for 22 years with my husband Neil. And we've been married for 37 years, and we have 5 sons and 3 grandchildren. And I'm a common sense conservative. I am pro-life, pro-Second Amendment, and I'm a fiscal conservative. I have a background in nursing. I served as and worked as a neonatal intensive care and a flight nurse for almost 18 years. And after serving as the legislative liaison in Northern Kentucky for the Heroin Impact Task Force, I served as and am the founder of the Office of Drug Control Policy in Northern Kentucky, where we work to stem the tide of the addiction issue that we have here in Northern Kentucky. I've served as the Kentucky Medical Association Alliance President, the Kentucky Physicians PAC Chair, for 2 terms. I was elected. I was the first non-physician to ever chair a physicians PAC in the nation. And I served as the president of the American Medical Association Alliance in 2017 and 18. So I've done work on a local level, a state level now, and a national level as well. I was first elected to the Kentucky General Assembly in 2016, and so I've served since 2017. And I have worked in a very collaborative, common sense, and thoughtful way in introducing and passing policy. I currently chair the Health and Family Services Committee. It's a very busy committee, as you can imagine. A great majority of the bills that we pass actually involve health care. I also serve on licensing and occupations, elections, constitutional amendments, and the very important Judiciary Committee. I also chair the Criminal Justice Task Force for the American Legislative Exchange Council. And I'd like today to touch on three basic areas really affecting Kentucky's long-term economic security and our overall health and well-being. And that is healthcare, tax reform, or economic development, one and the same in my opinion, and education. As a healthcare professional, I prioritize healthcare, including mental health and treatment for substance use disorders. I've worked on these issues since I came in 17 and have been very successful in passing common sense policies that really put more resources in place for individuals who are suffering with addiction. As drug policy director, I brought HIDA, or the high intensity drug trafficking areas, to northern Kentucky. It's intended to bring federal funding for support of law enforcement and our local drug strike force, and that's exactly what we did. We must continue to fight drug trafficking in our region, and that's what the intention of HIDA was. I could go into HIDA. It's very important, plays a very important role across the nation. But the point is, we must always support our law enforcement for the safety of our communities. We are seeing a rise in violent crime across our nation, and we just need to continue to treat individuals with substance use disorders, but we also need to hold criminals and traffickers accountable for any of their criminal actions. In the legislature, we've strengthened penalties for trafficking or distributing fentanyl, which we've seen rise on our streets. We have better funded law enforcement, and we will continue to do so as long as we are in control. We will never defund the police, as has been mentioned before, and we just need to continue improving our relationships with our law enforcement for community policing and really get a better control, better handle on the safety of our streets. Another part of what I have worked on in the legislature is to improve resources, including more and better treatment options, medication for addiction treatment, working with judges in the criminal justice system to ensure that people are getting the help that they need versus simply incarcerating individuals. I was just appointed to the Judicial Commission on Mental Health by Chief Justice John Minton, and this is a commission which will work to take a look at the judicial response to mental health. We know that we incarcerate rather than treat individuals with severe mental illness, and so that's it's a priority of mine. These are all near and dear to my heart as I worked to pass legislation to increase care for and to deal with crisis management. I passed a bill implementing mental health first aid in our schools and in our communities, and also mental health parity, which increases insurance coverage for mental health issues on par with any other medical condition. We know that Kentucky's poor health affects everything else that we strive to improve, whether it's education, our workforce participation, and the criminal justice system. We are improving Kentucky's poor health metrics like heart disease and cancer, and targeting our Medicaid dollars to programs that we know actually work. We are looking at, there's a lot of conversation around access to care, and we have expanded Medicaid, but individuals still are not accessing the care that they have the ability to, and so why is that? And so we've passed some legislation to work on actually connecting the dots for those people, connecting them to the health care that they actually have access to. We're looking at social determinants of health and helping patients manage their chronic diseases through the implementation of community health workers. And so we made that a Medicaid reimbursable service to, again, target those Medicaid dollars and use those precious taxpayer dollars on programs that we know actually work. I've gained a reputation in Frankfort as one of the hardest working legislators. I I actually have, last year alone, passed 11 pieces of legislation that were signed into law by the governor. A few examples are the community health workers that I just mentioned. House Bill 219 was Lung Cancer Screening Act, and it implements and really talks about Kentucky's #1 in lung cancer, first of all, and so we really need to address that. We need to get people into earlier treatment, earlier assessment when the treatment is more effective and it's not as hard on the individuals, and it costs the individuals less, and it costs our healthcare system less. So we really need to think about the high cost of healthcare when we're talking about access to care. House Bill 604 established the Kentucky Center for Cannabis Research. We know that medical marijuana is a very hot topic, but we don't have the infrastructure in place to actually know what the indications are, know how to dose, and know what the contraindications are. And so all this does is puts in place a practical approach to establishing a medical marijuana program if the legislature comes back and decides that that's appropriate. We dealt with the healthcare worker shortage in legislation to improve and increase healthcare workers in underserved areas. And tax reform is another area that we've tackled. We are reducing the personal and corporate tax rate. We went from 6% to a 5% flat, and we are further reducing our personal income tax to 4.5 if revenues continue to grow as they have. On education, currently school choice is an important topic to me. Currently, school choice is only available to the wealthy. Taxpayers should be able to decide how and where to spend their money and how and where to educate their children. We have implemented some legislation to allow for school choice. Some of it is enjoined in court, which is exactly what happens as soon as we pass these bills. But it's important to note that we have more fully funded public education and those SEEK dollars than ever before. We put an additional $525 million in the budget to allow for school districts to give teachers raises if they so chose. And some did, some didn't. Kenton County actually increased, gave teachers a raise of 5%, plus it's indexed for inflation as well, another 1 to 2%. So that was very important. We've also passed, one of my bills in the past allowed KEYS money for trade schools, and we've seen this really come to fruition in our own district in Latonia. We have the new Ensweiler building going in, which is increasing trade schools, training, and so forth for students. So I'm very excited to see that that is making a big difference. We've dealt with the pension. We now fully fund the actuarially required contribution for teachers to stabilize the pension and protect our teachers, keep things solvent. And then just a few last things. I won't keep going because I could, but transportation in Kentucky is very, very important. In Northern Kentucky, one of our budget sub-review committee chair, Sal Santoro, was able to bring $1.3 billion to Northern Kentucky in road funds and finally address the bridge, which we've been talking about for 30 years. We have updated disability insurance and unemployment and child care assistance. So we are working on a lot of really practical things that get people back to work. I've been endorsed by the Fraternal Order of Police and the Kentucky Chiefs of Police. I fully support law enforcement and have done so in legislative initiatives. We've made a lot of positive changes here in Kentucky in the past several years, and I just hope to continue the positive growth, dealing with the health issues that we are seeing beginning to pay off. I care deeply about our families. I care deeply about healthcare, education, and economic opportunity. I'm a fiscal conservative and will look for efficiencies and deficiencies in our government. I will always point them out. And I just want to be that common sense voice of reason in Frankfort to continue thoughtful policy discussions. I'm very collaborative, and I know that we can't serve our constituents unless we listen to all sides of the issue. And that's what I always do. I'll continue doing that, and I just ask for everyone's support on November 8th to continue the good work that we're doing in Frankfurt. There are many ways to get in touch with me. I am very accessible, but my website has more information. It's Mosier for Kentucky, kentuckyspelledout.com. So that's all I have, and I'm happy to be here and take some questions.
Take 2 minutes for questions and answers.
Sure. Yeah, thank you.
What distinguishes you from your opponent?
I would say my experience is very valuable to Kentucky, my common sense approach, and the fact that I am very collaborative. When I work on policy, I convene all stakeholders and I listen to all sides of the argument, and we make a policy decision that just actually helps people. I often say that the legislation that I pass is not knee-jerk. It's not a knee-jerk response to anything. It is thoughtful, and it may not make headlines, but it helps people.
Okay, I have a question. There are two constitutional amendments on the ballot. Would you please explain number 2 and then number 1? We'd greatly appreciate that.
Of course, of course. So constitutional amendment number 1, or number 2, you wanted me to talk about 2 first, is the constitutional amendment that clarifies the Kentucky Constitution's language on abortion. And all it says is that there is no language explicitly outlined in our Constitution that gives the right to an abortion or taxpayer funding of abortions. That's really it. It allows the separation of powers, which is important, and it keeps, right now, every time we even speak about abortion or pass any legislation, it immediately ends up in court because there's this question about whether or not our Constitution actually explicitly allows it. And so this would just clarify that there's no language that says anyone has a right to an abortion. It also keeps activist judges from deciding when it really should be the will of the people, and that's what the legislative action is.
All right, number 2. I mean, number 1.
Oh, number 1.
Sorry, number
yeah,
1,
okay.
Yes, that's the legislative assembly issue. Okay,
yes.
sorry.
So constitutional amendment number 1 would allow the legislature, the Speaker of the House and the Senate President, in collaboration with leadership, to decide if we needed to come in to deal with an emergency. And so this would allow the legislature to call themselves back into session for up to 12 days. It doesn't have to be contiguous. It doesn't have to be at a certain time. It really intends to give the people a voice in any time of emergency.
Well, I'm very protective of the amendment for the state's amendment. That's amendment number 10. I would like to get the federal government out of Kentucky and let us have our Constitution. We are the United States of America. We are not the United States of Washington, D.C.
Mm-hmm.
And so I believe that those 2 constitutional amendments to the Kentucky Constitution will protect our sovereignty in Kentucky.
Mm-hmm.
Do you have closing remarks for a couple of minutes?
I think I've...
we got another question.
Oh, we have...
How do you feel about, there's a controversy on the proposed tank tax about rescinding it. How do you feel about that?
Tank tax?
Yes, where it supplements the cost of tank. There are people who say that we should be paying that if they're not necessary. How do you feel about it?
Mm-hmm. It's we're talking about the I guess a subsidy for public transportation. Yeah. Because tank is our only form of public transportation right now. I've not seen that. I haven't said, I mean, there's probably some discussion about that. I don't know that I would support public funding of tank, although I think that there are probably ways that individuals who are receiving benefits probably have that built into some of the assistance that they receive. I don't know, I would have to think about that, because I do know that transportation is often a barrier for individuals who are, having a hard time with healthcare and so forth. I would have to think about that. Thank you for bringing that to my attention. I appreciate it.
Kim, has the drug situation got worse or has it improved?
So we have a whole lot, we have many more resources in place than we have in the past years. I mean, I would say that from a resource standpoint, it has improved over the past 10 years. We understand addiction more. We understand what people need to heal from their addictions. We have seen fentanyl, though, and it's difficult because we started out with alcohol is still our number one drug of addiction, but we saw heroin, and then we saw fentanyl kind of creep in, and the drug traffickers are very good at maintaining their foothold, and so it's hard to stay ahead of it. But we have better resources. I would say it got worse during COVID. And that was largely because of all the shutdowns. People were not able to access care and participate in their treatment. We've made a lot of strides in telehealth. We made a lot of changes in those policies to allow some virtual treatment in case of those sorts of emergencies. So our numbers are up. Our border's not secure anymore, so I mean, we're seeing fentanyl come in. So I mean, it's a difficult situation, but another really important reason to continue supporting our law enforcement and interdiction efforts.
Okay.
Yep.
All right.
2 minutes to play.
Yeah.
Well, you know what? I think I covered everything. I mean, I'm just grateful to be here. I'm grateful to serve the 64th District. As you can tell, I'm really passionate about the work I do. I think it's a very good fit given my background, and I just appreciate being there and having the ability to support the initiatives that my constituents care about.
All right.